Good evening, everybody. I'm Sayukta from Vistas Media, your host for today on Hair All Issues Resolved YouTube channel. We go through a lot of look beautiful related issues as we grow up, but little do we realize that, it's our hair that's our crowning glory. Our hair symbolizes health and personality. To guide us on how to take good care of our crowning glory, that is our hair, we have with us an expert dermatologist, Dr. Radhika Gupta, Heranjal, live from Vapi, Gujarat. Dr. Radhika is a renowned consultant dermatologist with expertise in laser and cosmetic treatments. She is the founder of Heranjal Advanced Derma Care Center, Vapi, Gujarat. She has worked as a consultant in Kaya Skin Care in Mumbai and ex-HOD of Sri Vinoba Bhave Civil Hospital, Silvassa, currently also working as a consultant with ESI Group of Hospitals and has an experience of 8 years. Doctor is well versed with histopathological assessments and diagnosis, proficiency in cosmetic procedures, namely chemical peeling, subcushion, microneedling, RF, Botox fillers, etc. Today we'll talk about hair care with Dr. Radhika. A very warm welcome to you, Dr. Radhika. Hope you're doing good.
Yes, I'm good. Thank you so much.
Dr. Radhika, monsoon is one of those, time during the year when we really have big hair issues, frizzy hair, dry hair, not, our hair is not getting dry. Please, we would like to begin this session with some tips on how to take care of our hair, especially during these damp and humid monsoon days.
Yeah, so like you rightly said, monsoon is not the favorite time of the year for hair, and I think hair fall at this time is just out of control because the thing is, our hair, if we see the ultrastructure of our hair, it has the outer cuticle, then it has the cortex and the medulla, the inner two things that it has. So when this humidity level is so high, this outer cuticle, it just takes in all of the moisture and becomes really soft, and when it becomes soft, it becomes really weak, and that is basically the reason why we experience so much hair fall, so much frizziness. Again, because the more porous it is, the more water it absorbs, and it becomes very frizzy and it becomes curly, and it's difficult to manage. So I think once we know what the issue is, I think we should be able to take care of it. So try not to keep your head and your hair wet very often. Wash your hair regularly, dry them fast, take care of the inflammation. Dandruff is again a very big issue that happens when with all this inflammation, with all this absorption of water, our scalp takes in a lot of that moisture, and this inflammation, the sweat secretion. So our scalp is constantly secreting all this oil, but because of the humidity, it is not necessarily evaporated, so it just stays on the scalp, forms a coat which is dirty for the hair, and it leads to inflammation and dandruff. So wash your hair regularly. Make sure you dry your hair once it's washed. Use a nice cleansing shampoo, and make sure you alternate it with an anti-dandruff shampoo if you can, so that you prevent the buildup of fungus in the hair or any other kind of inflammations. Once in a while, it's also not a bad idea to use a shampoo with just small amounts of steroid in it to make sure that the inflammation is very well taken care of. Apart from that, definitely during this time, taking some nutritional supplements is beneficial, as it just gives us that anti-inflammatory effect. It decreases that inflammation just a little bit. That helps us with the hair fall. So yeah.
Okay, so as you said, washing your hair or keeping your scalp clean is very important. Now, the question is how often to wash, plus, the temperature of the water, because during monsoon, as otherwise the, temperature is a little low, we like to bath or have a shower of a little hot or lukewarm water. But which temperature is good or adequate or appropriate for our hair?
So in general, for the hair, the best temperature to bathe with is either lukewarm or cold water. Very hot water is never advisable, and I understand the temperature might require us to do that. But as far as it's about the hair and the scalp, I think lukewarm water or cold water is the best. Definitely when it comes to males, they have oilier scalps. They have many more sebaceous glands than we have. They secrete more oil. So males should wash their hair slightly more often. So if you've got oily skin, if you have a tendency of breaking out, if you have a tendency of having dandruff in your hair, I do recommend that you wash your hair alternate day. And for females who I feel do not have that much of an oily scalp, I feel twice a day, twice a week is also enough. Once a week, I feel there's going to be a lot of buildup of sebum, so I do not recommend that less. But definitely 2 to 3 times a day is good. But yes, it varies person to person, so that you can gauge.
Okay, so keep your scalp clean. That's really important. Doctor, one more thing. It's also important, as you said, is to keep our scalp dry. But, after washing, because the outside temperature is not that much that will actually naturally, dry up our scalp or hair. What to do? Because we use a lot of, blow dryer, hot air, etc. What to do?
No, I don't think so. During this time, using any kind of technology or product on the hair will only make it worse. So I think using a very fine ultra fiber cloth towel to clean your damp hair, and then as much as possible let it air dry, and then if it's not possible, then use a blow dryer but on a cold setting, and that's probably the fastest way you can dry your hair. I definitely do not recommend a hot blow dry or anything like that.
Okay, and especially during monsoon, we hear a lot about dry shampoo. So are they good? I mean, we can use them?
They're a quick fix, yes. It's good to have one handy when you realize that your hair is really oily and you don't have an option. But then again, it's product that you're putting in your hair that you're not removing. So in the end, it just forms a cast between your hair and just becomes a part of the debris that's occluding, that's basically covering your sweat glands, which should otherwise be open to throw out the sweat and sebum. And that mixed with the skin cells that come out of our head that we are constantly exfoliating, I think dry shampoos I do not recommend for somebody who already has dandruff, who already has inflammation, already has hair fall. It is not recommended.
Okay, and doctor, when you're talking about, the monsoon care tips for hair, you also said about fungal infection. Please shed some light over it.
Okay, so normally also, otherwise also, when we have dandruff in our hair, we think about many things. So yes, if it's a dermatological disorder, that is a different thing. That's a different kind of flaking. That's a different kind of dandruff. But the most common dandruff that we come across during monsoons is a fungal infection caused by a fungus known as malassezia. And it just needs that perfect humid environment to grow, and monsoons unfortunately give us that. So just using an over-the-counter antifungal shampoo is sometimes not the best way to go, as we can tackle it by giving oral medication. Yes, using antifungal shampoos help, but when we go to medicated shampoos, they are also augmented with other peptides. They are augmented with other medicines that not just take care of the fungus, but sometimes also take care of the inflammation and many other things. So, I mean, if you feel you've had dandruff and it's been there for long, you should definitely go ahead, consult your dermatologist, and take proper medicated shampoos for dandruff or hair fall.
Okay, that was really very informative. One more thing, you said that, it's also important, especially during this period of time, to have vitamin supplements.
Yeah. Oh, absolutely. Because with monsoons, with dandruff comes hair fall. So definitely.
So what are those vitamin, supplements that we can include?
Yeah. So ideally, I frankly believe that in order to stop hair fall, vitamins and minerals might not help as much. But once you're suffering from hair fall, which most of us do 4 times a year, when the weather changes, a good amount of nutritional supplements is great to stop the hair fall. In my opinion, my favorite vitamins that I feel on supplementing help with hair fall is your vitamin A, your vitamin B, and your vitamin D. In your vitamin B, definitely biotin, your B7, vitamin B12, and B2. I feel riboflavin. They really help in controlling the hair fall. Then along with your vitamin, your minerals, your micronutrients, which we are otherwise not able to supplement. So a lot of the people, a lot of my patients who come to me say, doc, हम तो खाते पीते घर के हैं, हम तो सब कुछ खाते हैं, फिर क्यों हमारा hair fall हो रहा है? Yeah, then why are you advising us to have supplements? So what I tell them is that these are medicines that have micronutrients in them that are essential, that is essential for your hair growth and to stop your hair fall. And so even though you're eating well, there is always those little small things, your selenium, your iron, that you're missing out on, your ferritin.
Right.
And that supplementing with supplements makes a lot of difference, brings a lot of difference to the hair fall.
Especially vitamins and minerals, because they are so micro, there are chances, most certainly, that will miss on that.
Magnesium, magnesium, zinc, selenium, iron, ferritin, your vitamins. When it comes to stopping hair fall, I think A, B, C, D, E, all of them are essential. And but definitely B and A are my preferred choice when I'm supplementing them.
Okay. And doctor, the most favorite topic when it comes to, hair care talk is all about hair fall. Now, people are so scared because every day we are shedding hair, but we don't know what's normal and when to be concerned. Like, okay, now I'm losing more. So how to count that?
So for a healthy young adult male or female, the standard norm of losing 100 hair a day is actually normal. It's not a big deal, even though it might seem like a lot. But I think when we're washing our hair or tying our hair, we do shed hair, and up to 100 is absolutely normal. If it's more than 100, then yes, you should worry. If you're having, again, prolonged hair fall, longer than 2 months, or longer than, even in today's day and age, I say longer than 1 month, if you're constantly suffering from hair fall, you should definitely visit a doctor and take a consultation.
Okay. And what are the general causes of hair loss?
So, when we're talking about non-scarring causes of hair loss, I think in our country, it's safe to say that stress and malnutrition take up around a big part of the basket. And unfortunately, with our females not eating so well and menstruating and this and that, I think deficiency in hemoglobin, anemia, becomes a very big issue for hair fall again. And which is why supplements become important. So so that is there. Then there is definitely genetic causes. There's family history of hair fall, and then when as you age, you experience those hair falls. There are many dermatological diseases that can lead to hair fall, and I am just talking about non-scarring causes of hair fall. Then you have your androgenetic alopecia, your male pattern of baldness, then you have your female pattern of baldness. So, but then yes, coming back to the simpler things, I think stress is something that can lead to a lot of hair fall. Sometimes autoimmune disorders. Again, in our country, alopecia areata is a very common condition where, because of your internal makeup and sometimes some small immune changes, you develop hair fall. So yeah, these are just off the top of my head a few things that can lead to hair fall. Yeah.
So stress can lead to hair fall, and hair fall can lead to stress, and it goes like a vicious circle. So to break that, we need to take good care of our hair and to consult a dermatologist so that we know, what's the actual cause of that hair fall. So that's really important. You said that, healthy eating is very, very essential so that we don't lose on the micronutrients or macronutrients. How important is to have a healthy lifestyle? I mean, food part we have also already talked about, but other than that, how important it is to have a good sleeping pattern, have a good physical workout, etc., to control or restrict hair loss.
Yeah. So when I talk about stress, it's not just physical stress, but it's emotional stress, mental stress, oxidative stress, which basically leads to hair loss, and that's where your lifestyle plays such a major role. So a simple thing like having a very long screen time, if you're on the computer for longer than 6 to 8 hours a day, which most of our techies are these days, that will just give you, if you'll ask them, they'll just say, doc, there's this constant headache that we are having. It's not too bad, but it's there, right? That is also a stress, if even when you're working out a certain amount of hours a day, that's great, but if your workout requires you to work aggressively, excessively, that is another form of physical stress. If your work requires you to yell and scream, if you're a businessman in our country, that leads to a lot of mental stress, right?
Right.
Lifestyle plays a huge role, and I think it's all the stress that gets our body to produce a lot of oxidants, and that leads to hair fall, hair thinning, hair aging, everything.
Okay. Now, what are the medical options we have to combat those hair fall or hair loss? For example, you said that if you are experiencing more than 100
Yeah.
count a day, or for a month you are
Yeah.
losing hair, then you should be concerned and consult a doctor. Now,
Yeah.
in that case, what are the medical options that I'll get?
So we have many options nowadays. We can start with antifungal. We've got an array of antifungal drugs. First, we need to figure out why the person has hair fall, right?
Right.
So, if we can diagnose if it's a disease like a psoriasis, or like I said, a seborrheic dermatitis or dandruff, so individually treating that has its own domain of hundreds and hundreds of drugs. Now, if somebody has a non-scarring hair loss, which is a simple male pattern or a female pattern hair loss, which I think most of us are now suffering from when we touch 35 years of age, we have many topical medications that we can start with. We have different topical peptides. We have Procapil, we have Capixil, that with regular application are really beneficial in stopping hair fall and giving us hair growth. We've got vasodilators for our scalp that help in increasing the blood flow to our scalp. I think most of us are aware of it. It's called minoxidil, one of the compounds. And topical application or oral consumption definitely helps in not only stopping hair fall, but delaying the aging of hair and delaying the thinning of hair and giving us new hair. Definitely starting with oral supplements plays a huge role. Our vitamin D's, our zinc, our selenium, all that helps a lot. So oral medication, then we have oral alpha reductase inhibitors, our finasterides, dutasteride. So there are just in the oral and topical application domain, we have around 15 to 20 drugs that help us immensely in stopping hair fall.
Okay, and apart from that, I'm sure surgical, non-surgical,
Oh,
all options are available.
this is just medical. Sometimes it's not enough, and then we go to non-invasive techniques where we do our mesotherapy, where we just infuse the scalp with growth factors, with plant-based growth factors or natural growth factors. When that's not enough, there is the wonderful PRP, platelet-rich plasma therapy, that helps us immensely, along with microneedling to give us new hair, to stop hair fall, essentially everything. And when we surpass that, also there's always the surgical option of going for a hair transplant.
Okay. And after another very common problem these days is, hairs turning gray at a very early age. So graying of locks is again very common. How to deal with that?
So again, since we are in a developing country, graying of hair early on, always think nutritional deficiency first. And then genetics second. So if your parents have had graying of hair early on, then there's a good chance that you can experience graying of hair as well. Apart from that, supplementing vitamin D, people who get graying of hair early on, we've known to find that they have a deficiency of vitamin D in their bodies. So supplementing that makes a lot of difference. Then we've got drugs, we've got calcium pantothenate, selenium, that we can use. We've got topical solutions that we can apply for these patients, and then eventually and slowly it shows an improvement. So
Okay, and because again, graying of hair, especially at an early age, is not very confidence booster. So definitely, the person is so much in distress that they'll go and end up coloring their hair with lots of chemicals, etc., and ultimately damaging their locks. What's your advice on that?
um, It's I think it's go for what's best for you. I think it varies from person to person. So definitely take medical help, because if it is treatable, that's the way it's going to get treated. But camouflage therapy, going for hair coloring agents that are natural, is an option. It's not completely out of option. Going for that is good, but before you reach that, I think going for visiting a dermatologist and taking a proper treatment for 3 to 6 months. Again, when it comes to using hair coloring, taking a consultation with your doctor and figuring out which hair color is best for you, which dyeing agent is least irritating for you. I think those things can really make that journey slightly smoother without any side effects like irritation or redness or burning in the future. We can prevent all of that with just a little bit of consultation and research.
Right. So even if we are going for hair coloring, etc., then at least we can take an advice so that we know, what ingredients or agents to miss or, to omit from the
Because I
products.
think in today's day and age, people are starting from applying coffee to mehendi to hair dye to whatnot. So I think
Yes, yes.
a generous advice taking session with the doctor will go a long way in not letting your hair go through all that. So
Everything in the kitchen goes into the cooker on the karhai, and it also goes on our skin and on our
yeah.
scalp. So yeah, I was actually trying to also talk about that. How far these home remedies, not the ones which are nani dadi has made a tradition for us, but also those which these days the influencers or videos etc. also making very popular. So how far these actually go in hair health?
So, in my honest opinion, and I'll be very unbiased here, I think when it comes to conditioning the hair, moisturizing the hair, improving the texture of the hair, I think there are many masks in the market and or many DIYs that really work. But when it comes to stopping hair fall or giving new hair growth, that's an internal matter. So
Right.
that's where I think it's all Photoshop, and that's where these things just stop working.
Mhm.
So I think if you want volume in your hair, you got to see a doctor. But if you want shiny hair, you can probably go see a YouTuber. So, but that's it. That's where it ends. If you really want healthy hair, it has to be a composite approach. So yeah, I think that's where I'm a little on the fence when it comes to that.
No, but that was very clear. And one more thing, doctor, what happens that doctor is always our last resort, especially with
Yeah.
hair things. Now, if we have excessive hair loss, etc., we'll go consult a friend, we'll go consult the chemist in the shop, we'll go consult an influencer, but we won't go to the doctor at the first place. Now, we would just like to understand that if we surpass everybody else and go first to the doctor, what's difference it's going to make?
It's going to save you a lot of money. It's actually going to save you a lot of headache, because you're absolutely right. In today's digital age, I think doctor has become the last resort. But then that is why what we see is a very changed and delayed situation when the person comes to us for help. And whereas just 6 months before that, when things would be actually better if they visit, so I think we can give a faster improvement, we can give a better improvement, and we can decrease the duration of therapy considerably towards the patient, for the patient, if they just come to us early on with their issues, instead of after a huge reaction or something like that.
So you'll save money, you'll save time, you'll save headache, and you will save a lot of hair. So
Yeah.
please go and consult your doctor. That's really important at the first place if you see something unusual happening with your scalp or hair, rather than going for n numbers of products. Because these days, due to the market gimmick, there's so many products. People are claiming that they'll make customized shampoo or conditioner as per your hair or your scalp, and people are really confused and they get trapped in that gimmick, and they'll buy one product this month. Okay, this is not working, then I'll probably go for that. And ultimately, they in the whole process they lose a
And
lot of hair.
yeah, and I agree, and they're really desperate. I mean, it's a very fine line. One day you're just experiencing hair loss, and the other day you're like, oh my god, I got to do something. So sometimes it's desperation that gets them to do this. But and of course, computer is the easiest access. Reaching your laptop is the simplest thing to do. So it's understandable, but I really want, like, people should go past that and then do that in the night, but then go meet your doctor the next day.
Right. So I think the best way to use the internet is to search for a good dermatologist or a trichologist who will, solve their problem, and not searching for any over-the-counter medication, self-medication, or videos, etc. And doctor, the one more big issue and a very common issue is, as we have already, I think, touched it, dandruff. And men tend to have more dandruff than women. So
like I said before, male skin is inherently genetically oilier than female skin. They have bigger and more in number. Their sebaceous glands, their sweat glands are bigger and more in number, and because of which they tend to sweat more, they tend to secrete more sebum. And dandruff is basically just that particular area where there's excess of sebum being colonized by the fungus. So they just provide better environment for the fungus to grow, and that is why they tend to have more dandruff in their hair. Also, I think somewhere it's the care gets delayed a little. And because females in general, I feel, are slightly more conscious about their appearance and slightly more conscious about how they take care or they carry out their hair. So I think it's a simple thing of washing their hair more regularly, as opposed. And I hope I'm not stepping on many toes, but I think it's just that little extra care that a female gives to her personal self.
Right. So by keeping a clean scalp, we can avoid or at least arrest the problem of dandruff. I'll also
but then I'm sorry, I'm interrupting, but then again, for males or for females also, for that matter, if you've got dandruff and it's just not going and it keeps coming back and there's a seasonal increase or decrease, that does not necessarily mean that it's just plain dandruff. It could very well be a dermatological disorder. So visit your doctor, because they won't just, it's sometimes you think it's dandruff, but the kind of dandruff, the flakiness, the oiliness, a lot of that, that only a doctor can assess, and we cannot as much. And many times there are big skin conditions just masking themselves under the mask of simple dandruff, right? So it should not.
So what may look dandruff to me may not be dandruff actually. So that's why if we are continuously having dandruff, or it's increasing with seasonal change, etc., then we should go and consult a dermatologist. Is what you're saying. Okay, I'll also take some of our viewers' questions, Doctor. Saloni Mehra is asking, how many times a week should you wash your hair?
Hi, Saloni. So if you've got an oily scalp and it tends to get oily every second day, then I would say in this weather, alternate day. And during the winters, probably once in 2 or 3 days. If you've got a drier scalp, then once in 3 days, but never more than that.
Okay. Rajan Mehra is asking, ma'am, does using hair dryer or straightener damages hair?
Of course, very much. So you have to understand that your hair structure is just a small thread with many layers of things that is getting the hair going. And every time we do artificial treatments on it, we are basically changing the structure of that hair completely, which is very unnatural. We are damaging it. We are breaking the cortex. We are breaking the cuticle, and we are just making our hair more sensitive to further outside damage. So, between the two that you said, I think hair straightening is much worse, and hair drying is also not advisable on regular basis.
Okay, and doctor, what about those rebounding or keratin, etc. therapies that's available, and we to have those sleek, straight, shiny hairs, we go for it.
So rebonding completely changes the structure of our hair. The cuticle is bound together by different kinds of bonds. There are salt bonds, there are disulfide bonds, and every time we go ahead with rebonding, we completely change that structure. And in turn, we make our hair very, very sensitive, very, very prone to breakage, and that will just lead to thinning of hair much faster. So I think permanent hair straightening is one of the worst things that we can do to our hair. And I'm sure all of us have tried it one time or the other. So the only thing I'll say is I think try it early on while you still have hair. And then don't not recommend it at all, never.
And especially, people who had gone for it, they'll agree with me that there's such a bad chemical-based smell that you get while getting the treatment. That itself tells you, how much chemical are you taking on your hair. So, yeah, as far as when you have hair, you may go for it, but then, going to.
Yeah.
Yeah, for sure. Sapna Mangal is asking, please answer. Okay, which type of water, hot or cold, is good for washing our hair?
So I've already said this before,
Yes.
lukewarm water or preferably cold or no, not very hard water. More than the temperature water, I think it's the hardness or the softness of the water that is even more important, because when it mixes with the shampoo, if it's a very mild shampoo, the hard water, the salts of the hard water react with the shampoo and form a cast on your head. So interestingly, that is one of the reasons, because I think aaj se 10 saal pehle we were all using soaps on our head and we weren't using shampoos at all. So the major difference between a shampoo and a soap is that when the soap mixes with hard water, it forms a cast on the scalp and is one of the biggest reasons for hair fall and dandruff. Whereas with shampoos, there is more sulfate in the shampoo, milder ones, but they help in proper cleansing of the scalp and they don't react with the water in the bad way. So I think the answer to the question is lukewarm to cold water, soft water.
And what about those people where, soft water is not available? Because hard water, again, is a very common problem these days, with increase in population, less of resources, people actually living literally in jungles, etc., where, concrete jungle is coming up. The hard water is very common these days.
Yes, as much as possible, avoid. I don't want to say drinking water owing to the scarcity that we're already living in, but definitely take more care of your hair in that case, more conditioning. Give yourself oral supplements regularly. Once a year, go for a health checkup, check if you have deficiency, so that even though you can't cater to that one issue that you're having, you'll cater to all the other around it. And that way you'll be able to supplement your hair. So,
okay. Yeah. We got that. Raksha Parmar is asking, can pulling back my hair going to cause, thinning of hair?
Yeah, Raksha, so there's a thing known as tractional alopecia. So you'd see people who wear really tight ponies, after a while, just this part of the hair or the side of the hair, you'll see that they've got thick hair in the back, but here they've got streaky hair. So what happens is, at the end of the day, you're giving stress to the hair, right? All the traction, all the tight pulling, it damages your hair at the level of the roots. So tight pulling of the hair gives rise to a known skin disease known as tractional alopecia, which is loss of hair because of constant pulling. So yes, it's not advisable.
Okay. Alka Singh is asking, what is the cause of dandruff and dry scalp?
So dandruff and dry scalp, if you have it together, sometimes you can have sensitive scalp, which can lead to dandruff. There are literally hundreds of reasons for dandruff in the scalp. So the type of dandruff, when you get it, how much you get it, all of that helps us decide. I will only say try to use a shampoo regularly, and in 3 to 4 washes also, if your dandruff doesn't go away, visit a doctor, because like I said, you never know what's lying underneath. So don't overlook a dandruff that's been there for long.
Okay. In India, we also have this tradition of oiling our hair, and oiling our hair to the extent when the oil is on our scalp for hours, 8 hours, 9 hours, 10 hours. We sleep with it. We like even going out with the oil on our scalp. So please, enlighten us on that. How much oiling is important, when to have it, when not to have it, and is anyway oiling helps us or not.
So there's so much I want to say. I think oiling in itself can be an hour-long discussion. But when it comes to oiling, I mean, because it's an age-old tradition, raat ko laga ke tel so jao. Another thing that I really find very difficult to go around is that most of the schools in our country have a rule that you have to oil your kids' hair if you want to send them to school.
To the contrary, in many foreign countries, especially faced by Indian kids, because their parents will, send them to school with oil on their hair, and their teacher will like, oh my God, we don't, we won't allow your kid because he or she is here with oil on their scalp. Now that is a shock for us because here from ages we are practicing it. We love oily scalp.
So no. Your scalp is self-sufficient to secrete its oil and supplement the hair. Oil is a type of a conditioner. Oil by definition is a conditioner, and how we tell our patients the conditioner should not be applied on the scalp. Oil is important for the roots. So when you see the length of your hair, in a 10-inch long hair, we have 1 centimeter growth of hair every month, right? So a 10-inch long hair, the roots of the hair are much older. That's experienced a lot of chemical, sun, heat, and vigorous combing and this and that. So that's the damaged bit, the bottom part, the bottom, right? This needs a lot of oiling and conditioning. This needs a lot of care. When not given, can lead to breakage, can lead to split ends. But as we go up, the requirement for oil decreases. Still, because we cannot live with oil for some reason. So I would recommend that oil your hair not more than 2 times a week. Keep the oil in your hair for not longer than 2 hours every time. So it's just a simple 2 and 2. Keep it for 2 times a week. Keep it for 2 hours at a stretch, and then wash it off.
Okay.
And honestly, olive oil, coconut oil, almond oil, any oil is fine. I really don't ask my patients to even spend much on their oil, and I tell them, in fact, interestingly, I tell them to apply the oil on their body, then on their heads, because we tend to rub soap on our bodies like it's the last time we're taking a bath. So and we give ourselves extreme dry skin. So I tell them, apply less on your head and more on your body, and that's probably going to be better.
Good one. Raja Sharma is asking, मैम क्या हेयर एक एज के बाद कम होने लगते हैं? अगर फैमिली में फादर या दादाजी के बाल कम है तो मेरे भी हो सकते हैं क्या?
जी हाँ, बिल्कुल राजा, आप बिल्कुल सही कह रहे हो. एक एज के बाद जैसे हमारी बॉडी से सब कुछ धीरे धीरे जा रहा है, तो हेयर भी जाता है. एंड यस, व्हाट यू आर एसेंशियली ट्राइंग टू डिस्क्राइब इज androgenetic alopecia, मेल पैटर्न ऑफ बॉल्डनेस. इफ देयर इज फैमिली हिस्ट्री, अगर आपकी फैमिली में हिस्ट्री है कि आपके घर के बड़े बुजुर्गों के बाल समय से पहले गए हैं, तो देयर इज अ वेरी गुड चांस दैट यू माइट आल्सो एक्सपीरियंस इट इन योर मिडिल एज.
ओके. सानिया लोधी पूछ रही हैं, प्लीज गिव सम एडवाइस ऑन हेयर व्हाइटनिंग. इट्स वेरी सीरियस प्रॉब्लम. Yeah, we have already spoken about it, gray hair. Yeah. But still, anything that you would like to add to that?
Nutrition. Work on your nutrition. If you're a young adult female that's experiencing whitening of hair, can I just work on your nutrition? Improve your nutrition. Watch for your stresses. क्या है जो आपको physically और mentally stress out कर रहा है? Your sun exposure, your dust exposure. What kind of damage you're giving to your hair by straightening it, coloring it. By what all substances you're applying in your hair, that's not very useful for the hair. And definitely visit a doctor, because we can slow down the process, we can stop the process, but it's very difficult to reverse the process. So the earlier you reach your doctor, the faster you're going to be able to stop the process or slow it down.
Exactly. तो जितने हो गए हैं वो ठीक है, लेकिन बाकी के बालों को आप ग्रे होने से, सफेद होने से बचा सकते हैं. तो न्यूट्रिशन पे ध्यान दीजिए, डॉक्टर से मिलिए. एंड डॉक्टर, मुझे लगता है ये एक्सेप्टेंस भी जरूरी है कि बाल है तो बहुत अच्छी बात है, उनकी केयर करनी चाहिए. अगर गिर रहे हैं, नॉर्मली हेयर लॉस हो रहा है, तो डॉक्टर से मिलना चाहिए. या ये भी देखना चाहिए कि कोई अंडरलाइन कंडीशन, हेल्थ कंडीशन तो नहीं है कि आपके बाल गिर रहे हैं तो एक्चुअली इसकी वजह कुछ और है. ये सब करना चाहिए. लेकिन फिर भी अगर बाल नहीं है या कम है, तो उसको लेके बहुत ज्यादा स्ट्रेस नहीं करना भी जरूरी है, क्योंकि आपने कहा कि एक एज के बाद बाल झड़ते हैं. अगर जेनेटिक भी है, अगर घर में फैमिली हिस्ट्री है, तो बहुत चांसेस है कि आपके भी कम होंगे. तो वो एक्सेप्टेंस लाना भी कितना जरूरी है, बिकॉज एज वी आर कंटिन्यूसली सेइंग कि हमारा क्राउनिंग ग्लोरी है और इससे हमारी पहचान बनती है, पर अगर नहीं भी है तो हमारी पहचान बिखर थोड़ी ना जाएगी.
नहीं, दिस इज आई थिंक बहुत ही सही बात बोली आपने, एंड आई कंप्लीटली एग्री विथ यू. आई थिंक जो मैं बोलती हूँ कि हमें एक होलिस्टिक अप्रोच चाहिए जब भी हम हेयर फॉल की बात करते हैं. उसमें मेडिसिन एक तरफ हैं, लगाने की सीरम सॉल्यूशंस एक तरफ हैं. आई थिंक काउंसलिंग and understanding your problem and understanding कि ठीक है, it's okay, अगर कोई problem है भी तो I think counseling becomes a very important part. एंड आई थिंक काउंसलिंग ही वो एक चीज है जो हमारा मेंटल स्ट्रेस कम करती है, बिकॉज हम कितनी भी बार बोलेंगे स्ट्रेस मत लो मत लो मत लो, इट विल नॉट वर्क. Understanding the disease and understanding that it's okay is far more important. I absolutely agree with you, and that's a very big part of the holistic approach when it comes to treating hair fall, you know.
Yes, absolutely. And doctor, before we sum up this session, any takeaway message for our viewers?
Don't stress out too much when you see hair fall. You've got plenty on your head, and eat well, stay healthy, and your body will figure out a way to give you hair back. So just what we started with, I think that's, if you don't want to follow anything else, one take home message that I would like to give is din mein 100 baal girna normal hai. So don't worry, it's okay, and it's just hair, baal hi to hai. So those are the only two things I tell all my patients. So yeah, I think that's probably it.
और अगर कोई दिक्कत है तो डॉक्टर भी तो है, तो प्लीज डॉक्टर से कंसल्ट कीजिए. Exactly. So thank you so very much, Dr. Radhika. Again, it was a pleasure to have you and to talk with you. It was a wonderful session, very informative session, and thank you so very much. And I'm sure जो भी आपने गाइड किया है, that will actually help our viewers, to अंडरस्टैंड कि क्या करना चाहिए, क्या नहीं करना चाहिए, कहाँ हम गलत कर रहे हैं, और सब कुछ सही करने के लिए बहुत जरूरी है कि हम बिना वक्त जाया करें डॉक्टर से मिले. एंड व्यूअर्स, अगर आप डॉक्टर राधिका से कंसल्ट करना चाहते हैं तो हिरंजल एडवांस डर्मा केयर सेंटर, वापी, गुजरात, आप विजिट कर सकते हैं. और थैंक यू सो वेरी मच डॉक्टर राधिका वंस अगेन.
Thank you so much for having me.
Thank you. And viewers, thank you for watching the show. And for more information on how to get all your hair issues resolved, do like and subscribe our YouTube channel, Hair All Issues Resolved. Thank you. Goodbye. Great day ahead.